Hi, this is Dr. Patrick Felice. I'm a double board certified plastic surgeon in Avon, Connecticut. I wanted to take a few minutes here to discuss breast enhancement procedures involving augmentation of the breasts, lifts, and reductions, and the differences. Understanding breast augmentation involves increasing volume using either silicone, saline implants, or fat transfer. Placement options are typically either above the muscle or below the muscle, and it's customized to your anatomy. I prefer an inframammary crease incision for my breast augmentations, as I don't really want to go through the breast tissue and create scar tissue via a periareolar approach. Ideal candidates are those that are wanting to restore volume after pregnancy, weight changes, or just enhancing their natural size. The breast lift is a procedure where skin must be removed. The nipple areolar complex is typically below your inframammary crease, and you need a lift to provide that. I've provided a little chart on the side here, as I feel very strongly that all lifts and reductions in that matter should be performed according to the size of the breast and try to minimize the scars as much as possible. The whole purpose is to reshape the breast tissue and lift it into a position that's more natural to your body shape. This involves several measurements, which should be done at the consultation, with showing you the results of those measurements. If you are in a consultation with a plastic surgeon that does not do measurements, I would be very leery, because these are critical to obtaining the proper uh, uh, shape of your breast natural to your body. And I think that makes the best outcomes possible. With regards to the breast reduction, the breast is essentially the same as a breast lift as far as scars are concerned, but there's actual tissue removal. That tissue that is removed should be marked in all quadrants and sent to pathology, just in the untoward effect or event that something would be in there that would be either pre-malignant or malignant, and you certainly want to know about that before anything else uh, occurs. The augmentation technique and incision, typically I will do an inframammary crease incision. The augmentation is tailored size wise to your natural body shape. Again, these measurements should be made, as these are critically important to obtaining the proper result, and also sizing with implants in a bra at the time of consultation helps in determining the size. Lift and reduction incisions are typically around the areola, as the entire nipple areolar complex is rotated up into the proper position attached to the breast tissue to try to maintain all sensation and functionality. The scar is typically a short scar, lollipop type of scar with a small inframammary crease incision. Now, this may change depending on the amount of skin that needs to be removed, which would extend the incision a bit. But I very much adhere to not extending to the middle of the chest or laterally toward the axilla, as these scars are very visible. Again, the approach is based on your anatomy, aesthetic goals, and your current breast condition. What are the recovery expectations and timeline? Typically, this is a same day procedure. You go home the same day. I would expect swelling, bruising, a little soreness within the first 1 to 2 weeks. You can resume normal activities typically within about 3 to 6 weeks. Reduction, full healing is achieved within 6 to 8 weeks. And over the 12 to 8 month period, the scars fade significantly, and should be uh, uh, pretty non-visible and discreet under clothing. Of course, there's going to be a white line and base as a baseline, as this is a scar, but we monitor our scars very closely and make sure that they are not uh, progressing beyond what they should. And if they require a little laser treatment or injections with steroid, we will do that. Combining procedures for optimal results. I mean, a lift is often associated with an augmentation for those people that want more volume in addition to the lift. When we do reductions, typically the complaint about reductions is you reduce the tissues and they have no upper pole fullness. Sometimes we can do an implant at that time to create and shape the upper pole fullness in addition to the reduction on the lateral and medial sides of the breast. Um, Advantage of combining procedures is a single recovery period, avoiding multiple surgeries. And again, this is all based on your natural, balanced, proportional outcomes that really are tailored to you. Who benefits most from each procedure? Well, the augmentation is typically someone that's just seeking increased volume. So typically, this is a candidate that uh, has lost volume, either from pregnancy or weight loss, or they've just never had much volume. A lift is typically for sagging from aging or weight loss, post pregnancy changes, um, and reductions are typically for very large, heavy breasts that give you physical discomfort, inability to really exercise properly. You might have back and neck pain and some emotional distress. Risks and considerations. There is scarring. There's no doubt that there's going to be scars. We place them in inconspicuous areas so that they're not visible under your clothing or in swimwear. There may be some sensation changes. Usually these are temporary. There's a small risk of permanent nipple numbness, but this varies by individual. Breastfeeding usually is not affected, but can be with large reductions in that breast tissue is actually removed and it may affect breastfeeding. Surgical risks are bleeding, infection, any anesthesia reactions. As I mentioned, some sensitivity changes to the nipples, and there's even a possibility of nipple loss. In the very large breast reductions, sometimes we will even do a free nipple graft to avoid losing the nipple areolar complex due to vascular compromise, and this will create an insensate nipple. In essence, we're transforming confidence. It's a quality of life enhancement. People really do benefit psychologically as well as physically from these procedures. And for more information and a consultation, I offer a complimentary initial consultation. You can call 860-242-0505, and I'd be thrilled to meet you. All right. Take care. Bye-bye.